Natural Family Planning Project has been implemented by the Uganda Catholic Medical Bureau since 2014.
Uganda Catholic Medical Bureau is the health department of the Catholic Church under the auspices of the Uganda Episcopal Conference, which is the body that brings all the different bishops or different dioceses together.
We started this project in 2014, and by the time we started, there was hardly any uptake in the Catholic facilities.
Natural family planning for Christians, it is important in a way that it is a safe method since it does not have any side effects. It is a matter of the couples understanding themselves, knowing their days, and then sitting together and plan.
The goal of the project is to increase availability, accessibility, and uptake of the new modern fertility awareness methods.
For a very long time, there has been this impression created generally by the public that the Catholic Church is against family planning. The Family Planning Project has demonstrated that actually the Catholic Church embraces and supports family planning.
The concern of the Church is about the method, but not about the subject of family planning per se.
As the Church, we want those who are married to follow natural family planning methods.
These include standard days method with cycle beads, 2-day method, and the lactational amenorrhea method.
As clients come, I counsel them on these natural methods of 2 days method, the standard day method, and the lactational amenorrhea method.
Help someone to know how conception takes place. This helps someone to get an idea of the 2-day method by talking about where the cervical mucus is produced. And this helps someone to know at least where the egg comes from, and where the fertilization takes place, and how the menstruation takes place. So it kind of gives them an understanding of their body. Then they are going to make a good decision, and you're going to talk about all these signs that communicates them whether they are fertile or infertile, and they really know what you're meaning and where it comes from.
Started using natural family planning method when we had it from a nurse in Angal Hospital. She's called Jen. So we pick interest right from there. We discuss it. We went to her. Then she taught us the other methods, but we got interest in the 2-day method, which is now working for us for over 5 years now.
Family planning can refer to the control of the number of children in a family and of the interval between them.
The fact that over this period of time, even the Minister of Health and WHO came out to say natural family planning actually works, just like any other method of family planning, if used well and consistently, it works over 95% effectiveness.
The significant contribution we feel that the project has achieved to date is having the Catholic health facilities institutionalize natural family planning services. So today you can actually walk to a number of the facilities and you'll find that family planning services are now available at the facility, and women are taking up service.
People now have started to come to request for fertility awareness method, which was not there before we started this natural family planning project.
I promote the doctrines of the Church, and in our doctrines of the Catholic Church, according to Canon 1752, it talks about the salvation of souls. You take human life as a priority. So in line with this, I strongly support the Catholic Church, and I see that the move that they have taken to promote natural family planning method is in line with God's intention, the purpose of creation, that we do things that way, because there's no life that should come accidentally.
The Catholic Church, with its limited resources, has trained providers in 31 health facilities including village health teams, ready to offer counseling in natural, modern, and effective methods of family planning. This has been done through radio talk shows and workshops.
We received a sensitization workshop during which we were appraised about the methods that are being promoted for natural family planning. That is the 2-day method, lactational amenorrhea, and SDM. Sensitization workshop went on well, and according to me, being a medical personnel, I felt that the information that we received was adequate for us.
We have integrated this method in our program, in our activities. When we go to the radio, one of the topics is natural family planning and fertility awareness.
Whenever staff are going to the communities for immunization and health promotion, family planning is key. They always talk about it, the different methods, and we are having several users coming to the hospital for further guidance just from these outreaches.
I received training from our organization, from the hospital, about natural family planning method variety, but I opted for the moon beads. This is because I felt it was easy for me to use, and with the support from my husband, it has even made it more easier.
The standard method uses a cycle beads. These cycle beads represent the menstruation cycle. So when I'm counseling these mothers, you tell them what the cycle beads indicate.
Can be used by women who can get their periods once in a month, and in terms of the length, women whose periods takes 26 to 32 days, and also for women who can adhere, or the couple who can adhere to abstain on the fertile days. How does this method work? It is by every day a woman moving the ring. The first day that a woman sees her periods, her menstruation, she puts the ring on the red color, and she keeps moving the ring every day. Every bead represents 1 day. When she reaches the white bead, she has already entered what? The fertile phase. Enters the brown bead, it means also she's in her infertile days. She reaches the black bead here. This shows that this woman can start her period anytime.
I went to hospital. This hospital of ours, Kakira Hospital. I got one nurse. I told her that, could you have any other method you could teach me other than this artificial family planning methods? Then she said, yes, we have one. Then I said, I want that one. Then she said, it is called moon bead. You use the beads. You count those beads and I will teach you how to count them properly. But then she said, but I want 2 of you with your husband. When I came and told my dear husband, he didn't reject. He went with him and they taught us. Here we are.
Washako ng'eyo kuom method ni through VHT remo bini bango kakeni. One of our natural method. Mathelembe ne through ponje me ponjwa. Wanwango niya ya. Awia bibedu through I plan mamwa nango meto ni kom kwan mawabi nene komo tegu
These methods promote love and faithfulness between husbands and wives as they cooperate with God in procreation.
We were working with health facilities and communities. So we're working at 2 tiers to ensure that family planning reaches the people, both at the community level and at the facility. So the design was appropriate. And the most significant thing, like I said, has been the realization that there are other methods.
There is now an alternative, and that makes it easy also for the religious leaders to go out and talk, because they're able to offer options.
The sensitization that is brought by the natural family planning and the different stakeholders coming on board, different community members have made to understand that I can control birth through understanding with my wife. I can control birth by not taking any pills.
Able to be confident to inform our clients that, look here, we do offer family planning, and specifically we offer natural family planning. And this took away the concept of a hospital as like a NGAL, which belongs to the Catholic diocese, not being able to offer family planning services.
Methods are modern, effective, and easy to use. They are cheap and can be used to postpone pregnancy as long as the couple wishes.
I like it so much because it has no side effects. It is not expensive. They don't spend anything apart from getting the sensitization from the health workers. And it improves on the communication. The woman is able to know her body and share with the husband together.
I am really a real beneficiary of natural family planning. As you can see, the gap between my children is not a problem. I am very happy about it. It has made my family very easy to run, and I have loved it so much.
For us, we used the method in the two ways. In the first place, to achieve pregnancy. The second time was to postpone pregnancy. So from the time of our last son, who is now 7 years, we are like not looking forward to having another baby. And we are still using natural family planning.
It is a safe method because there is no medicine that is used, and then also it is inexpensive because it is a matter of the couples understanding themselves, knowing their days, and then sitting together and plan.
Fertility awareness methods are safe with no side effects and thus preserve a woman's health and enable the couple to freely enjoy their marriage.
Omiyo riko tiyo gini kelo nung'et tipo pejigi eto kitu ponyo wakeri wan VHTs ni do tumiyo gi ng'et yigi do tiyo yomo ko bido peku nung'u tuo ka natita.
The community members, both the adolescents, adults, and the old, have embraced because it has no side effect.
I got myself when I'm free, when I'm using this Moonbee, because I can also have a lot of appetite. My man is even also having so much interest on me because I'm now free. However much he comes or at night or at what time, I'm just there for him.
Kati obulungi bwenfunye okukuuma abaana bange bokubakuza mu family ennungi ge magezi ge nafuna ag'obutonde ge natandika nawuli wano mu Sentanto nentwala ekigambo ekyo ng'ekikulu kyali kitono naye nenkitwala mu mutima nekinkolera kale nfunyemu obulungi bungi bumpa n'okubuulira nange abantu ne bagamba nti no bw'obeera national ey'okuyigiriza ey'obuzaalwa osobola okuwona empiso.
The success which you have experienced is that since we began using this thing here, Madam has no any side effect. As abdominal pain, when she starts moving, going on her period, she goes normally and she will never experience any pain, any what.
It also promotes couple communication and cooperation, thus promoting responsible parenthood.
It is important for the public out there and the policymakers to know that the fertility awareness methods of family planning are part of the methods that are available for people who may find difficulty using the other methods.
Uganda Episcopal Conference, through support from United States Conference of Catholic Bishops, Institute of Reproductive Health, and Catholic Relief Services, has supported the scale-up of natural family planning. However, not everyone has been reached due to limited resources of the Catholic Church.
had challenges from the users. One, with the male partners who come back home when they are drunk and they are demanding for intimacy, and you find the mother is already in her fertile days, and yet they have already agreed that they are going to use natural family planning method, which do not use the artificial one. So putting this mother in the risk of getting pregnant when she's not ready for this.
Most of the people have not been aware about the different methods of natural family planning. So there has been that barrier that we have been trying to break. We are trying to go past that, and we are really intensifying the awareness creation.
We have facilities that are far away in communities. We have been sensitizing communities through radio talk shows, but some of them are traveling up to the office here, which is far away. So if we could have a center, I would be happy, whereby those within town could go and we handle them from town here, because facilities are in rural areas and they are far away in parishes.
The Uganda Catholic Medical Bureau has future plans of expanding to all the 296 facilities countrywide.
We appreciate the donor community so much. We thank you for your generosity towards this cause of spreading natural family planning, because it is through your support that we are able to reach out to the communities.
So we need their support, both morally, we need their technical support, we need their financial support to get the message across. We have only just touched a bit with the project. To the government, the same message.
For the government of Uganda, I recommend that they need to integrate natural family planning into the programs of family planning that are being rolled out in the country.
Yes, to the donor community, our appeal to them is that if they can extend support to help these new methods, get elevated, and we increase awareness in the community, you realize that these methods are actually cheap. They're cheap in terms of there is no need for refills. Once you get the knowledge, that is enough.
When they are preparing the marriage couples, that should be part of it. And even they should have that chance of interacting, of getting to know, so that they promote.
I appeal to all people who can give us all types of support, to support us in this process, at policy level, at funding level, the donors and the government and other partners to support us in this process, so that we pool our efforts together, efforts from government, efforts from us all, for the good of our society.